Hello, everybody, and welcome. I'm joined here today by the wonderful Dr. Portela, who's been a partner to us through this COVID-19 pandemic. Excited for her to introduce herself here. My name is Scott Frunheim. I am the proud CEO of Distinctive Schools, and excited to kick off the conversation today. Dr. Portela, you want to introduce yourself and tell us a little bit about yourself?
Yes. Hi, guys. So my name is Paola Portela, and I am a board-certified pediatrician here in Chicago, and I am also the Chief Medical Officer for the Angel Harvey Family Health Center.
So today is really focused on helping our families understand the impact and the benefits and the protection of the COVID-19 vaccine. We know that the vaccine eligibility has been expanded over the past couple of months. As we click here to the next slide, I'll give you an overview of a little bit of what we're hoping to cover here today. And from there, we'll just jump in with a few questions if you don't mind.
Yes, perfect.
Okay, so tell us a little bit more about the COVID-19 vaccine. What is it actually? If families are wondering, what is in it?
When it comes to Pfizer and Moderna, you're basically having a vaccine that will incorporate itself into the cells and pop out antibodies. Overall, it's just a vaccine that's going to protect you and your family against COVID-19. It's really to protect against the serious illness and complications of COVID-19. So I've seen a lot of people say, you can still get it, or you can still give it to someone else. But the truth is that data has shown time and time again that those that are vaccinated will have a less rocky course, and they will be protected against being hospitalized or ended up intubated in the hospital.
As we think about these variants that are popping up, we've had folks say, people are still getting sick with the vaccine and the boosters. And so can you talk a little bit about some of the benefits still of the vaccine?
The people that are vaccinated and that do have boosters are having an extremely mild version of COVID. So again, it doesn't prevent 100% against getting it. Almost like when we get our flu shots, you can still have a breakthrough, but it's going to be a lot milder, and it is going to prevent the severe effects of hospitalization or something worse, including death.
Thank you so much. So a lot of our families will say, why should my kids get it? We've opted out of potentially other vaccines. Why is it so important right now for kids to get this vaccine?
We need everyone to be vaccinated in order to create a herd immunity and to decrease the levels of hospitalizations. So it's extremely important for our little ones to get vaccinated, for them to be able to play with their friends and interact and do age-appropriate things. And so it's extremely important for everybody to do their part so that we can finally go back to our daily life.
Families will say to us, is the vaccine safe? And how do we know it's safe, especially for our youngest ones, ages 3, 4, 5, when it's approved for 3 and 4. But for our 5-year-olds, say now, how do we know it's safe for our kids to get it right now?
The science behind the vaccine has been around for decades. Even though it seems like the vaccine for 5 through 11 has only been out for about a month or two, this has been going on and in development since the beginning of COVID. They have looked at the after effects, the comorbidities, and they have determined that the vaccine is definitely safer than the risk of actually getting the disease.
Another question that's come in is just the side effects. Many of us as adults who have received the vaccine experience some of those side effects from either the first or the second or the booster shot. Can you tell us a little bit about what you and others across the nation leading this work are seeing in children aged 5 through 18 right now?
Yeah, believe it or not, I am very surprised at how well the littles are doing with the vaccine. Our children 5 to 11 are doing fabulous, and they don't really have any symptoms, if at all. I have noticed that our very older population, let's say 80 and above, and our little people 10 and below have done so well with the vaccine, where they don't really have any side effects whatsoever. Otherwise, yes, it's a little pain in the arm. Yes, it's a little tiredness. But for someone who got COVID prior to the vaccines being available, it was a very small price to pay.
a big part of our work at Distinctive Schools has really been looking at the equity work, especially where there's been mistrust in the healthcare system and families, many of our families that have experienced mistrust in the healthcare system, really feeling worried about where to go and the resilience of being able to commit to a vaccine with providers. Do you have any advice for our families in Detroit or in Chicago who may be nervous to get the vaccine based on documentation status or based on any other factors that may be providing them fear about going to the doctor or going to get this shot?
It's very scary, and I understand because in the past, a lot of entities in the 60s, 70s, they weren't very forthcoming with the information. Luckily, there are a lot of things in place now for things for transparency, for the work to include people of all backgrounds, and so we do have data. And right now, speaking personally, being of a Latino background, we have a high incidence of high blood pressure, diabetes, cholesterol. And so our older, and I'm talking about like 30, so it's not that old. We have a higher risk of being hospitalized and ending up intubated or passing away from COVID because of those comorbidities. And it is the same in our African American population, and we need to be protected against as well. So in the past, I think people thought if I stay home and I am safe, I just won't get COVID, and then I don't have to deal with having to go to the hospital or things like that. I have a 10-year-old and I had her vaccinated. She did absolutely amazing. And over the holiday break, she developed a fever for about a day and I didn't think anything of it, but I went ahead and tested her and she did test positive. And that fever that one day was as far as it went. And she did absolutely amazing. And I have now brought in her little best friends to the clinic to get vaccinated. So I have vaccinated my parents, my significant other, my children. This is something that, I'm walking the walk and talking the talk. I've done it to my own children, and I highly recommend it.
I think for our families to know across our Distinctive Schools network, talking to your school is a really safe place to start. Our nurses at our campuses and our school leaders at each of our schools, if you want support with finding or identifying access points to find the vaccine, and we're wholly committed to doing that in partnership with you all, specifically at Angel Harvey here in Chicago for our Chicago families. Dr. Portela, lots of talk right now about schools being open and being a safe place to be. We've prided ourselves on making sure our mitigation efforts are really strong. We've actually been really proactive about making sure we're communicating transparent measures for classroom quarantines and building closures. We've heard Dr. Arwady speak here in Chicago and the Department of Health in Detroit talking to us about keeping safe schools open as long as mitigation protocols are being followed closely. Any advice or words of wisdom or inspiration for us and our families to know about coming to school and keeping us safe?
From the beginning of the pandemic until the children went back to school, the the rates of depression, of sadness, of isolation, of keeping children at home, of having them excel in school, it was bad. It was bad. And as much as schools try, sometimes we think about ourselves in our current situation and we say, well, my child will be safe at home. A lot of children don't have that same safe haven when it comes to their house. And so schools are doing everything that they possibly can to be clean, to mitigate risk factors, to help children understand why they need to be vaccinated. And so right now, when a child can't stay home or when a child really needs to go to school because of all the factors we just spoke about, school is the place to be because you guys are doing as much as you can to keep them safe and to keep them learning.
That is our number one goal every single day to keep everyone safe and learning. And I appreciate that. As we think about, some of the vaccine awareness and some of the fears around vaccines, we appreciate you being here today to give us this confidence and this support. But any advice for us is if we're having conversations with each other, maybe an unvaccinated person that we may want to encourage to get vaccinated, how we might talk about it or bring it up in a safe space.
So I think that somebody has to be open to it. I do believe that, data is important. And the data shows that those who are vaccinated will have a lower chance of being hospitalized with serious disease. If everybody puts their defenses down and really looks at what's good for the common goal of getting people back to where we used to be, or some sort of a new norm with us being vaccinated, the data shows that the vaccines do work, that there is less issues and dangers getting the vaccine than actually getting COVID. And so, if somebody looks at the data, it's really hard to say otherwise.
Awesome. Thank you. That's a hopeful message for our littles who are planning to get vaccinated to ease some fear and anxiety there. Thanks for sharing that. Dr. Portela, for our families in Chicago, and they might be interested in saying, "Oh my gosh, I love Dr. Portela. She seems awesome." How might they access, healthcare through Angel Harvey Health Center?
We have our website. We are at the corner of Central Park and Fullerton. We have a wide array of services, from dental to behavioral health to medical, and not only for children, but through end of life care, including midwives and OB care. So we are there. Everyone that I work with is so passionate. We're doing our best, and we're doing it because we truly believe that it's worth doing. So I would love to see you guys there. If you have any questions, we have nurses that can answer your questions as well. And I just really wish that you guys will reach out to someone and ask. Don't have doubts, because I'd rather you get vaccinated.
Dr. Portela, to you and your entire medical team, thank you for the work that you've been doing in the most inspiring ways over the past 3 years as we've been navigating these things, and for continuing to inspire us. Thank you for echoing the message on vaccine awareness today, that it is safe and appropriate for all students and staff and family members who are eligible to be vaccinated and know that it is safe to do so. Dr. Portela, we appreciate you, the entire Angel Harvey Health Center team, and thank you for being here with us today.
Thank you, guys.
Thank you so much to all of our staff, our family, our students, our partners who have joined us today for this webinar with Dr. Portela and the Angel Harvey Health Center. We are really excited to see more vaccinations across our network and across our communities as we continue to keep each other safe. Thank you again for joining, and please reach out to your school leaders or to any of us here at Distinctive Schools for any more support you may need. Have a great day.